Chlamydia is one of the most common sexually transmitted infections, or STIs, worldwide. It's caused by a microscopic bacterium called Chlamydia trachomatis, which is invisible to the naked eye, but can have a significant impact on health. This tiny organism can quietly invade the body, often without causing any immediate signs or symptoms, making it especially tricky to detect without proper testing. Chlamydia is easily spread through sexual contact, including vaginal, anal, or oral sex. It doesn't matter if it's your first time or your 100th. Anyone who is sexually active is at risk. The bacteria can be passed from one person to another even if there are no visible symptoms, and even if ejaculation doesn't occur. Age, gender, or sexual orientation doesn't matter. Chlamydia can affect anyone. It's especially common among young people, but adults of all ages can get it. Many people don't realize how widespread it is, and because it's so common, it's important to understand how it spreads and how to protect yourself. The infection can be transmitted through any kind of unprotected sexual activity. Even if you or your partner don't notice any symptoms, the bacteria can still be present and passed on. That's why regular testing is so important, especially if you have new or multiple partners. Chlamydia can also be passed from mother to baby during childbirth. This can lead to serious health problems for newborns, such as eye infections or pneumonia. Pregnant women are encouraged to get tested so that any infection can be treated before delivery, helping to protect their babies from complications. One of the most challenging things about chlamydia is that most people don't realize they're infected. Up to 70% of women and 50% of men may have no symptoms at all. When symptoms do appear, they can be mild and easily mistaken for something else, like a urinary tract infection or mild irritation. For example, two partners may trust each other and feel healthy, but if one was infected in the past and never knew it, they could unknowingly pass chlamydia to the other. This is why open communication and regular testing are so important in relationships, even when there are no symptoms. The bacteria thrive in the body's mucous membranes, such as the cervix, urethra, rectum, or throat. These areas provide the perfect environment for chlamydia to multiply and spread, sometimes leading to complications if left untreated, like pelvic inflammatory disease or infertility. It's important to know that you can't get chlamydia from everyday contact like hugging, sharing food, or using public toilets. The bacteria don't survive well outside the human body, so casual contact isn't a risk. Prevention comes down to practicing safe sex, using condoms or dental dams every time, and having honest conversations about STI testing with your partners. Getting tested regularly is a simple way to protect your health and the health of those you care about. Understanding how chlamydia spreads and knowing the importance of regular testing helps you take control of your sexual health. Stay informed, stay safe, and don't be afraid to ask questions or seek help from a healthcare provider. Chlamydia is often symptomless. About 70% of women and 50% of men show no signs. When symptoms do appear, they're mild and easily mistaken for other issues. Women might notice unusual discharge, burning during urination, or pain during sex. Men may have discharge from the penis or testicular pain. Rectal or throat infections are possible, often without symptoms. You can't rely on symptoms. Only testing can confirm if you have chlamydia. Routine screening catches silent infections and prevents complications. Early detection means simple treatment and protects your future health. Genital sores are bumps, blisters, or ulcers that appear on or around the genitals or anus. These sores can look different depending on the cause. Some may be red and painful, while others might be painless or barely noticeable. They can affect anyone, regardless of age, gender, or sexual activity, and noticing a sore can be alarming or confusing. It's important to remember that genital sores are a symptom, not a disease themselves. They can be caused by a variety of conditions, but sexually transmitted infections or STIs are among the most common reasons people develop these sores. Understanding the underlying cause is key to getting the right treatment. The herpes simplex virus, or HSV, is the most frequent culprit. It causes clusters of painful blisters that can break open and form ulcers. These outbreaks can recur over time, especially during periods of stress or illness, and can be easily spread to others through skin-to-skin contact. Another major cause is syphilis, a bacterial infection that starts with a single painless sore called a chancre. Because it doesn't hurt, many people don't notice it, but if left untreated, syphilis can progress and cause serious health problems affecting the heart, brain, and other organs. Less common causes of genital sores include infections like chancroid, which leads to painful ulcers, and granuloma inguinal, a rare condition that causes slowly growing sores. These are less frequently seen, but still important to recognize and treat. Not all genital sores are caused by infections. Sometimes, non-infectious issues like ingrown hairs, friction from shaving, or allergic reactions to soaps and hygiene products can also lead to sores or irritation. These causes are usually less serious but can still be uncomfortable and require care. If you notice any new, unusual, or persistent sore, it's crucial not to self-diagnose or ignore it. Only a healthcare professional can determine the exact cause and recommend the best treatment. Early evaluation can make a big difference in your health and peace of mind. Getting checked as soon as possible allows for early diagnosis, which means you can start the right treatment quickly and prevent the infection from spreading to others or causing complications. Protecting yourself and your partners is essential. Regular STI screenings, open communication, and practicing safe sex are all important steps in maintaining sexual health and preventing the spread of infections. Remember, your health and well-being are worth prioritizing. Don't hesitate to seek help. Taking action is the first step toward healing and peace of mind. Prevention is your best defense. Use condoms correctly and consistently for all types of sex. They're highly effective barriers. Talk openly with partners about sexual health and STI testing before becoming sexually active. Regular testing is essential, especially since many STIs have no symptoms. The CDC recommends annual chlamydia screening for sexually active women under 25 and others at risk. Fewer partners means lower risk, but prevention is important for everyone. Combine condoms, communication, and testing for the best protection. Take charge of your sexual health. It's a sign of respect for yourself and others. Stay proactive, stay healthy. STI testing is simple and crucial. Chlamydia is usually detected with a urine sample or a quick swab. For genital sores, doctors may swab the sore or order blood tests to identify the cause. Accurate diagnosis ensures you get the right treatment and prevents complications. Don't self-diagnose. Mistaking a herpes blister for an ingrown hair or a syphilis sore for a pimple can be risky. Healthcare professionals are trained to help without judgment. Testing protects not just you, but your partners and the wider community. If you notice symptoms or have concerns, get checked promptly. Early action stops infections in their tracks. Your health and your peace of mind depend on it. The good news: bacterial STIs like chlamydia and syphilis are curable with antibiotics. For chlamydia, a short course of medication clears the infection. Just follow your doctor's instructions. Avoid sex until treatment is complete, and make sure partners are treated to prevent reinfection. For herpes, there's no cure, but antiviral medications manage outbreaks and reduce transmission risk. Daily suppressive therapy can help keep herpes under control. Untreated chlamydia can cause pelvic inflammatory disease, infertility, and chronic pain. Untreated syphilis can damage the heart, brain, and other organs. Prompt treatment protects your health and your future. Don't ignore symptoms or delay care. Inform partners so they can get treated too. Recovery starts with action.